guys. I'm Dr. Taz. I'm an integrative physician and champion of superwomen. I'm determined to make sure every woman realizes her powers and knows how to take care of herself.
Hi, my name is Jenna Finley, and I'm a genetic counselor. I work for Invitae, and in last year, actually, I decided to take one of Invitae's proactive genetic tests. And without a family history or anything, and expecting to be negative on this panel, this genetic test, I found out I have a mutation in a gene that causes an increased risk of breast cancer, which was a really big surprise. But it allowed me to be proactive about my health, and I've been followed up by a high-risk breast cancer clinic, and the results have really impacted my care, and not just my care, but like my entire family's care. So this has spread out to my parents and other family members. So yeah, that's why I'm here.
Hi there, everyone. My name is Rachel Rhee. Is there a little bit of feedback? I'm a women's health advocate, cancer survivor, and health and wellness content creator. I also run the blog, thedimplelife.com, which is really a guide and a resource for everyone to learn more about how to live healthy when it comes to health, wellness, and personal growth.
And I'm Reshma Gopaldas. I'm the head of video for She Media, and I'm also a breast cancer survivor. So let's get into it, guys. How can we better identify doctors that are the right fit for us?
I can jump into that. So this is something, so my practice, by the way, I've had for about 10 years. It's an integrative medicine practice in Atlanta. We have 2 locations, but I've grown it accidentally from just me and what was supposed to be like a hobby to a thriving practice with 2 locations and 10 doctors, and we've seen over 14,000 patients probably in the decade. But I tell you all of that only to say I've met women like you over and over and over again, and the number one complaint is like, why didn't my doctor tell me this? Why didn't somebody educate me on this? Why won't they test this? And it continues to be this just undercurrent of frustration. And I think for all of you, what you have to know is information's going this way, and doctors and medical education is still kind of over here. So that gap is something that everyone's having to navigate. I had to navigate it because of my own health. So I think the first thing is to make sure you interview your doctor and they have the same philosophy as you do. Like, if you're someone who's all medication, then that's the type of doctor you want to be with. If you want more lifestyle, more nutritional stuff, then maybe you need a different type of doctor. You probably need somebody who you can resonate with and someone who listens to you, because what we're understanding more and more about healing and the medical experience, it's a lot more about relationship than we even gave credit to before. It's always the like, oh, by the ways, and those type of comments that really lead to understanding what's happening with someone.
So Rachel, in your experience, how did you find a doctor that was the right fit for you?
Yeah, first of all, I take a very pragmatic approach when it comes to the healthcare that I get. So I would say even just take a step back, take a look at your health insurance and see what providers are within your network, or what works within your coverage and within your plan. Because when you're going through some sort of medical condition or any kind of health scare, whatever it is that's going on in your life, that's stressful enough. So to add on any sort of like financial burden or things like that, because later on down the road you find out that test that you took with that doctor, that person itself is not within your network, those kinds of things can really add to sort of that stressful situation. So I would just take a step back and first of all look at your insurance, and then also it's really about just identifying what your values are and what your priorities are when it comes to that relationship with your doctor, because a doctor-patient relationship is honestly one of the most intimate relationships that you can have with somebody, because essentially that doctor will know everything about your body. So you really want to make sure that you feel comfortable. If, for example, great bedside manner is something that's important to you, make sure that you really prioritize that when you do interview your doctor, like Dr. Taz mentioned. Or, if you're someone that perhaps is interested in, I want a doctor that will cut straight to the chase and, just tell me all the facts, like, what to look out for then at that point.
Yeah, and you can date around a bit. Swipe left, swipe right on your doctors. Just, find someone that's right for you. So in terms of testing, what is the medical community recommending in terms of testing? At what age should you start? How do you prepare yourself for the results?
Do you want me to jump?
Yeah.
So, again, I can talk about what's conventionally recommended, and then we can talk later maybe about how that needs to change. So conventionally, I think across the board, all ages, everyone's recommending A1C, which is a diabetes screen, getting your lipid levels checked, because we're seeing coronary artery disease and heart disease much, much earlier than we had in the past. So that's your cholesterol levels. Making sure you get at least those two screens, I think that covers all decades. For women starting, in their late teens, early 20s, starting to get PAPs, especially, you start earlier, the more earlier you are sexually active. So getting your routine Pap smear, I think, is important to do and important to keep up with. Doing your breast self-exams in your 20s, but then kind of graduating when you get to 30s, especially if you have a family history of breast cancer or any significant family history. Some doctors will recommend mammograms for those women, as early as 30 or as early as even 35. So that's how the landscape starts to change. Now, between 20 and 30, there's a lot that shifts with our bodies. That's, when I got into trouble, that's when a lot of women I see get into trouble, so we can talk about that later. And then as you go into your 40s, the new age for colonoscopy now has been dropped to 45. That's a more recent recommendation. So women need a colonoscopy in addition to everything else we just talked about, and then at least a baseline mammogram at 40. And then at 50, it's the dreaded, now it's 45 is the colonoscopy, but then at 50, the DEXA scan, or scan for bone health. So that's kind of the skeleton of conventional recommendations.
Yeah, and I would just add that there are updated guidelines too for some people if you have a significant family history, like you mentioned, of cancer or other conditions. Or in my case, I didn't have a family history of cancer, but with the genetic test in hand and my the particular gene that my mutation is in, there are National Comprehensive Cancer Network recommendations for how to be managed. So I started getting mammograms at age 30 when I would have normally waited till 40.
And how do you prepare yourself for the results? Because there are some, genetic tests that tell you have something that you really have no control over. So what do you recommend for that?
Yeah, I think that if you are considering genetic testing, I think it's really important to really do your research on the company that you're going to order it from. If this is a test that you want to use to make medical decisions upon, like a kind of test that you would be able to take to your doctor and that there would be actual medical management you could do, then you really just need to do your research to make sure that the company you're ordering from is a medical company and not just like a recreational type deal, because there's a lot of different options out there. Yeah, so I would just make sure if it was something that if you're looking at this for medical reasons, you would want to get it from a medical company.
So, Rachel, what are the baseline tests that, in your experience, you'd recommend for women in their 20s, 30s, and 40s?
Yeah, so last year in December, I actually went through my first cycle of egg freezing, and I'm someone that's in my mid-30s. It's something that I kind of thought about when I turned 30, but I never really just proactively really looked into it until last year, and I just decided sort of where I was at in my life, that was kind of the route that I wanted to take. And I learned so much about my fertility, and I think it's something that we as women can really learn to empower ourselves from with the information about our body. And so with my fertility doctor, he actually told me a few statistics that I wanted to share with you that hopefully it could maybe help you and just guard you with some more knowledge about your body. So he said that for an average healthy woman, at the age of 20, we have a 25% chance of getting pregnant each month. And as we age, that number sort of decreases with time. So at age 30, you have a 20% chance. At 35, 15% chance, and so on. And so, as women, we have eggs, and the most number of eggs we'll ever have is right at this moment. So I just think that knowing those facts about your body is just a good starting point if you are thinking about having children, or maybe if you think that you're on the fence about it, or if you're absolutely sure that you don't want children. There's really no right answer to that. But I do think that it is important that whatever your decision is, that you operate with the most knowledge you can about your body.
I just want to jump in on top of that, because one of the biggest things I see when we were talking about conventional screening, so what I listed out earlier was what's sort of routinely done, but I'm a huge believer that women from 20 need to be checking all their hormone levels, need to be looking at inflammation markers. So this is the advocacy part of where you have to sort of ask and you have to want to, the doctors sometimes won't routinely do it because going back to insurance, sometimes it's not routinely covered by insurance, but they're easy labs to do if they're coded properly. And sometimes that's where you can anticipate issues with fertility, issues with, autoimmune disease, some of your risks that are coming up earlier than waiting for something to show up and then, kind of reactively having to respond to that.
Right, and I went to a fertility doctor, but if you're not necessarily at that stage in your life where you want to take that step, you can easily, like Dr. Taz mentioned, go to a regular doctor and get some routine blood tests done. Some of the hormone tests that I had to take that can test your ovarian reserve, which is essentially the quantity of eggs that you have, not necessarily quality, but it can test the quantity, is testing your AMH level, FSH, LH, and E3, and those are all different hormone levels that you can test within various times in your menstrual cycle.
So, Dr. Taz, what are 5 symptoms or health irregularities that you should never ignore?
Oh, wow, that's a good one.
I'm like testing you.
So if we boil it down to 5 for women, I would say, first of all, energy. I think so many women discount a change in their energy. And if you are like a high energy go-getter and all of a sudden you're dragging and shifting and changing, well, that's a sign. I wouldn't just blow it off. So many women will say, well, it's just getting older, or it's just this, or I'm stressed, but there's a reason. So that's one. I would say any changes to your hair and skin, because oftentimes they're systemic, they're deeper, they're inside out issues. So like if you're losing hair dramatically, or if you're having a ton of acne, I think that's something you should pay attention to. I think anything that is cardiac or respiratory, like you're getting more short of breath, you're getting palpitations, you're getting episodic chest pain. So many of you guys ignore that. You think it's stress, or you think it's something else, and you don't get it checked out. So I would say that's something for sure to check out. Joint pains and joint swelling, it's another one. There's so much autoimmune disease right now. I would never ignore any changes in joint pain. And then I only have one more. So what's the last?
I think you hit 5.
Was that 5? Okay,
I think she passed the test.
Can I add one to that? I would say also if you notice any changes in your menstrual cycle.
Yes.
So personal experience, I was missing my period for like 3 years. I think I got my period maybe once or twice during that time. And this comes into kind of advocating for yourself. But I talked to my doctor about it, and she said, sometimes it just goes away. Sometimes it's just fine, and sometimes women just don't get it. And I knew deep down that just didn't feel right to me, but it took me a while to kind of advocate for myself and realize like, hey, maybe I should look into this a little bit more, whatnot. So I would say menstrual cycle is a big one.
So, Rachel, that's so interesting, because I was just going to ask, do you think that oftentimes women's symptoms are dismissed or downplayed? And how do we make sure that we're advocating for ourselves and that people are taking us seriously?
Yeah,
because a lot of times I think we're told, oh, don't worry about it.
Exactly, and that's what happened to me. And I also want to say, not that I don't know if it really makes a difference, but my doctor was female, so it's not necessarily like, oh, men don't understand or whatnot. It can happen with whatever doctor that you end up, choosing or that you're seeing. But your voice can be dismissed, but that's why you kind of have to speak louder and speak for yourself, because your doctor only knows a certain percentage of information that you choose to tell them, that they see in blood work or whatnot, but you live with your body 24/7, so you know what feels right and what doesn't. So if you feel like something isn't right, and if you feel like the doctor's answer isn't satisfactory to what you believe, advocate for yourself and say, hey, I did some research, or hey, this isn't how my body's been in the past, and just start asking some more questions. Start, saying like, if you want to go see another doctor, that's within your right to be able to do that and get a second and third opinion. You just have to be your best self-advocate.
And so, let's say a doctor is downplaying it. What should we do so we're not ignored?
I think there are a couple of things, and I see this all the time. So this whole phenomenon is gaslighting, where it was sort of, there's so many articles out about it right now, if any of you guys have picked them up, but where it's just sort of brushed under the cover. But I think the big thing is, don't give up. First of all, don't just accept when someone tells you it's in your head, or you're anxious, or you're depressed, or or it's normal. If you don't intuitively, and that's our power, is the ability to use our intuition. If you intuitively are not agreeing with that, then I think you have to get a second, third opinion. You have to work the system a little bit to figure out, who is going to give you the information you need. You may have to say, I want these things tested. So many of my patients have had to do that. So, those are steps you can take, or you find a different type of doctor, quite honestly.
And just a quick poll, how many of you have been told ever that it's in your head?
Oh, wow.
Oh, that's the saddest poll I've taken all day. So how can we better prepare for our doctor's appointments? What crucial bits of information do patients tend to overlook?
So one thing that helps for sure is to be organized going in there. I would prepare for your doctor's visit like you would prepare for a business meeting or for a presentation. You want to be able to tell the doctor, especially in the insurance-based system where there's a time crunch, you want to be able to tell them, these are my top 3 symptoms. This is what I'm experiencing. This is when it started. These are the things I have questions about, and you should bullet out your questions, limit them to 5. You shouldn't have 20 questions because you're going to be that patient, right? So limit it to 5 of your top questions, and then ask about solutions and treatments to all of those things. But just go in prepared. I think so many people go in unprepared and then leave unhappy and then ignore their issues. So I see that happen all the time.
And also, no symptom is too small. Like that little joint pain that you had in the morning, don't dismiss it for yourself and say, oh, I slept weird or I went on that hike or whatever it is. Just mention it, because you just never know. That might be a crucial piece of information that your doctor could use and maybe get you tested for something else, or, go down different paths. So I would just add that.
Yeah, and I would say also know your family history. That is really important and can help your doctor get on the right track as well. So a lot of times as families, we don't talk about our health issues, and you may not even know about some of your relatives' health issues. So I always recommend when you're getting together with your family during the holidays or something, I know it can be difficult to talk about health, but it is really good to interview your family members and ask them about their health and keep track of that and bring that information to your doctor.
And, just from my experience, if you do face a health scare or diagnosis, bring a friend with you to all the appointments. They should be there to take notes for you. They're your admin now, and your family can do that too, because it's very overwhelming to get all this information and digest it and advocate for yourself when you're just oh my gosh, I have cancer. So use your friends wisely. All right, final question for you guys. Jenna, I'm going to start with you. Where can genetic testing fit into women's health journeys?
Yeah, so I think that there's a lot of genes nowadays that if you're identified to have a mutation or a variant in one of these genes, there are actual clinical guidelines that have been established that that your doctor will tailor your health care to. So most people will be negative for these mutations. It's kind of you can take a screen, and if you don't have anything, then you can just go on with your life and you can be treated without genetics. But we have been finding about 1 in 6 people actually has a mutation in a clinically actionable gene. So there's quite a bit of medical care that can be related to your genetics.
Rachel, what is one thing you wish you had known maybe 2 years ago about your health?
I would say to approach your health holistically. I think a lot of times we can think that our health means, well, we got that workout in or we ate that salad. But I think health is so much more all-encompassing than that. It's about self-care. It's about managing your stress levels. It's about the relationships that we keep, because that really does affect our bodies physically as well. So it's just keeping in mind all the different kinds of pillars within wellness that we should just be thinking about.
Dr. Taz, what is one thing you can leave the audience with about genetic testing, about women's health in general?
I think just remember that you're all unique. You all have a fingerprint. You have a personal prescription that really makes you you. And the important thing in medicine and with your health is to find the prescription that works for you. And that is encompassing everything. It's your health, it's your finances, it's your relationships, it's your community, your stress, all of it. And very much what I talk about in the Superwoman RX, where you want to be able to put it all together, because that ultimately is what prevents disease. But more importantly, it's really what brings you vitality and brings you to your passion and to your purpose. Because my favorite stories in the practice are when women go through this journey of discovering themselves and their own health and their own powers, and they're like, I think I can start that business. I think I'm ready to have a child. I mean, it's pretty empowering. But imagine if they walked around like not knowing how to take care of themselves for all that period of time. So I think just own it. Own yourself, own your health, find your personal prescription for power, understand all the pieces of it, and then just go for it.
All right. Thank you guys so much. And everyone, own your health.